Did you go to your eye doctor's office, get fit with new contact lenses, and you don't know how to get them off? Or maybe you're a pro and you're just having trouble today. If you want to find out some quick tips for how to get that contact lens out, keep watching. Hello everyone. Today we are tackling a topic that's crucial for every single contact lens wearer out there: how to remove your contact lens. And by the way, I am Dr. Rupa Wong, board certified ophthalmologist, managing partner of Honolulu Eye Clinic for the last 15 years, and top doctor. Whether you're a seasoned pro or a total newbie to contact lenses, I've got something for you today. Not just one, but two foolproof techniques for removing your contact lens. After that, we'll do a deep dive into some tips and tricks that'll make the entire removal process a breeze. I'm also going to share some eye health advice, troubleshoot common issues that arise, and give you some tips for how to care for your contacts. So let's get to it. Before we dive into the removal process, let's just revisit why it's so essential to remove your contact lenses properly. Your contact lenses are created to fit snugly over the front surface of your eye, the cornea. That is the clear dome-shaped covering of your eye. When you go to your eye doctor's office, we're taking a bunch of different measurements to fit the contact lens appropriately to the curvature of your eye. And removing those contact lenses incorrectly can lead to irritation, potential eye damage, and even infection. That's why mastering the lens removal process is key to being a contact lens wearer. It also helps with the health and longevity of your lenses. You can't keep your lenses around if you wear a 2-week or a monthly lens if you are constantly tearing them as you take them out of your eyes. So that's why this is very important. Getting ready to remove your lenses is just as important as the removal process itself. Start with washing your hands thoroughly and drying them. That drying process is equally as important as washing your hands to get rid of bacteria. And the reason for that is if your hands and your fingers are still a little bit wet, it gets much more challenging to remove the lens from the eye. Find a well-lit area and have a mirror handy so that you can observe yourself as you're removing the lens. Also have with you your lens case and your solution. And then last, take out a clean towel and put it there as your prep space. You don't know how many times people have dropped lenses into a sink. Sinks are filled with tap water, and tap water is a very problematic thing for contact lenses. There are protozoa that live in tap water, and that would mean that essentially you'd have to throw that lens out. Our first technique is the tried and true pinch method. Here's how it goes. You're going to want to look upwards and gently pull down your lower lid. With your index finger and thumb, carefully pinch the lens and lift it off your eye. It's straightforward and effective, especially with a little practice. So try that a few times and see if the pinch method works for you. It's the most common way to remove a contact from your eye. If the pinch method isn't for you, then consider the slide and lift method. This method involves sliding the lens to the lower white part of your eye with your index finger, then gently pinching it off. It's particularly useful for those who find direct pinching uncomfortable. A lot of times, pinching can be challenging because you're unsure if the lens is actually on the surface of the eye, and people are worried about scratching their corneas. This is a nice way to circumvent that. Now, let's elevate your technique with some advanced tips. Hydration is really key at getting a stuck contact lens off your eye. A contact lens can get dried out for a bunch of different reasons. It may be because you've fallen asleep in your lenses, you're wearing them for an extended period of time, or because you're doing a lot of device time on a computer or on your phone. When we're on devices, we tend to blink less, and that's going to dry out your contact lenses even more. A dry contact lens really wants to stick to the surface of the eye, and that's what makes it challenging to remove with your fingertips. So using a re-wetting drop is going to help make it a lot more easy to remove the lens. And then always look in the opposite direction of where you want to move the lens. This is going to give you more room to maneuver. Removing contact lenses is just one way to keep your contacts and your eyes healthy. Also, remember to not stretch your lenses out. If you are wearing a 2-week lens, throw it away at the end of 2 weeks. If you're wearing a daily lens, please throw it away every single day. And same goes for a monthly lens. Stretching out a lens is going to make it drier, it's going to tear more often, and it might just be more challenging to get on and off. You may also notice that your vision is not as clear. In addition to adhering to wear schedules, you want to build a really good lens care routine. That includes daily cleaning and storage solutions. Now, if you're wearing a daily contact lens, you don't need to worry about that, which is one of the benefits of a daily contact. But if you are doing 2 weeks or monthly lenses, You need to make sure to never reuse solution, never top off. What that means is when you've taken a contact lens out and placed them on your eye, you want to dump all of the solution that's remaining in the case out and then turn the contact lens case upside down to dry. I prefer to not do this in the bathroom, or at least not in the room where you have a toilet, because there's a lot of bacteria that's flying around it. If you can put it somewhere where it's a little further away from your toilet, that's going to be a benefit. Every day you want to replace your lens solution. Even if you've been taking a break from your contact lenses and haven't worn it for a few days, you want to change out the solution at least every 2 days. And then last, your lens case also needs to be disposed of every 3 months. There's a lot of bacteria that can accumulate on your lens case, so do not just use the same lens case for a year. Your eye doctor has tons of samples. We give them out like candy. So make sure to get an additional lens case every 3 months. Is the lens still stuck despite doing all of these techniques? First, don't panic. More often than not, it's just hiding. And don't worry, the lens cannot travel behind your eyeball or to your brain. There is a pocket there that is going to prevent that from happening. A couple different things you can do: apply some solution, gently massage the eye, blink, and move the lens down. You may even want to flip your eyelid with a Q-tip and see if the lens is under there. I have a whole video on that. You can check that out right here. Usually the lens is going to work its way down and you'll be able to see it and remove it. If not, please feel free to make an appointment with your eye doctor, but this is really not cause for concern and is not going to cause any long-term damage. All right, guys, I hope this video was helpful, that we got your contact lens out of your eye and you can breathe a little bit easier. If you have any other topics you'd like for me to address, drop them in the comments below and I'd be happy to do so. Until next time, I'm Dr. Rupa. Bye-bye.